Assalamualaikum doctors. In this video I am discussing how can we take the DMSA scan consent. Okay, so as usual we do as IRCAP. I am here to talk to you about our plans for Ali and hopefully at the end of the meeting I can take your agreement. Okay, so but first, do you want anyone to be here? No. So how much do you know about Ali's conditions? So Ali has repeated infection in his urine. They told me to come here and to do certain procedure. I do not remember what is the procedure. Okay. So as you mentioned that Ali had repeated infection in his urine. So our consultant asked us to take a consent for a procedure called DMSA scan. Did you heard about it before? No. So it is a procedure in which we will inject a specific dye or chemical substance through the Ali's blood tubes and we will take a picture of his kidney by a special camera. Okay, so why you are doing that? It is very important. It tells us about the size of the kidney and if injured or damaged tissue in the kidney. So what is the difference from its jelly scan? The jelly scan can tell us about the size of the kidney but cannot tell us about the structure of the kidney and whether there is any damaged tissue or not. Am I clear? Okay. Could I explain for you the drawbacks of this procedure? Okay. For any procedure, as you know, there are some drawbacks. There is some risk of allergy. We'll be ready with a medicine to give him if any reaction appeared. Also, there is some risk of radiation and it is equal to what we get from the background environmental radiations and very long period of time. Are you with me? Okay. So is this damage to kidney diagnosed by DMSA is reversible? No. I'm so sorry to tell you that damage is irreversible. So why you will do it? Actually, it is very important to know whether he has any damaged tissue or not, the amount of damaged tissue and whether the damaged tissue at one side or both sides. So can you explain it more? Okay. For sure. For example, if one side only damaged and small may no need follow up, just discuss it with the kidney doctor according to family risk factor having hypertension. But if he has both sides are affected and a large amount of damaged tissue, we need to measure blood pressure every year, do the kidney function test every 3 to 4 years, and when he grows up he has to follow up with the kidney doctor. Okay. So okay, now he has some urgency and frequency. Can he do it? No. He has to wait for another 4 to 6 months. Why? Because we cannot do it while he has UTI. Also will give us inaccurate results. So any precautions for first 4 hour, plenty of fluids as much as possible, allow the dye to go out from his body. Also, if he is taking his medications, to take it as usual, and he should go to toilet as frequent as he can and wash his hands as well. I am pregnant. You should avoid the contact with his fluid, pee, poo and throwing up. If he wears any nappies, he must change his nappy as frequent as you can, and you have to dispose the dirty nappies and wash your hands very well. Then summary, website, leaflet, support group and consent. So you understand DMSA scan is what is that? We injected dye to the blood tubes, a chemical substance or dye, and we will take the picture of the camera, special camera to the kidney. If the kidney is injured, any damaged tissue present, these are we can understand by that. Some side effects can be some allergy reactions and radiation problems can occur. Another things, jellies can only show the size of the kidney structure, but damaged tissue, DMSA can we do. The damage of the kidney is irreversible, it is not reversible. But why we are doing that? Because we can under follow up. We understand how much damage occur. If few damage in one kidney occur, then we just send the kidney doctor to see the family history of hypertension. When he will be young, then he will be regular follow up maintained. And when UTI, we will not do the DMSA scan. When he good health, then we will do the DMSA scan. And there is some precautions that after DMSA, he will take plenty of water and frequent go to the pee to remove this chemical dye from his body. And if mother is pregnant, she will be avoid the fluid contact, pee, poo contact avoid. And we understand summary website, trusted website, leaflet we will give. Thank you.